Recording. Okay. I think I'm going to give it a couple more, maybe 30 more seconds and let people get in. You can see our participants numbers rising. Okay, I think I will go ahead and get started, and then people can just kind of hopefully trickle in. So welcome to the Texas State Board of Examiners of Marriage and Family Therapists, to our town hall. My name is Dr. Lisa Merchant, and I am the board chair. And I have with me three other esteemed board members. I have Daniel Parrish, he is our public member. And then I have Dr. Jody Elder, she is a professional member. And then I have I have Janine Smith, and she is another one of our professional members. And then also with us is Miss Sarah Fassholes. She is, you cannot see her lovely face. She is our board administrator. She is going to be managing the Q&A today. So if you have a question as we are going about our conversation, you're welcome to put a question. You're welcome to put questions into the Q&A, and she will try to answer those as we go. You can also save your questions for the last half of our presentation if you'd rather ask them verbally. And when we get to that part, we'll give you instructions on how to unmute and ask questions or raise your hand. If you stay in this meeting for at least 50 minutes, then you will get an ethics credit. So with that, let's go ahead and begin. So this is our agenda. The first half of this meeting, we are going to talk to y'all about just kind of a couple of things that are before the board right now. The first thing is the Uvalde report. This is a report, well, somebody else is going to tell you all about the report. But anyways, we're going to talk about the Uvalde report, and we'll talk about kind of the board's response to the Uvalde report, and what we've been trying to do to increase access to mental health care in in Texas. And then we're going to talk about some of the challenges that have come, that the board faces in trying to increase access. And then we're going to talk a little bit about the 2023 legislative session. And in the second half, we just really want to hear from you guys, and if there's things that we can be doing to increase access to MFT services in the state of Texas. So maybe barriers that you've encountered that we might be able to address, or just anything that you really think the board needs to be on our radar. So with that, I'm going to turn it over to Mr. Parrish.
Good afternoon, all. I am Daniel Parrish. I'm one of the public members, and I will be talking to you about the Senate Special Committee report to protect all Texans, the Uvalde report. The Senate Special Committee met in the wake of the Uvalde report shooting and made a series of policy recommendations regarding school and gun safety and mental health and social media and police training. The Uvalde report was created after the shooting, of course, at Robert Elementary School. It focuses on increasing mental health services for a number of the mental health providers. And in that report, that 88-page report, it really details expediting licensing, increasing access to supervisors, increasing portability, telehealth through compacts and reciprocity, standardizing licensing requirements across the professions and BHEC specific, and review of supervision requirements. And I'll turn it back over to Ms. Liston. Oh, you're on mute.
Thank you. Thank you, Daniel. So one of the other things I want to say about this is that these are all recommendations. I mean, this isn't a law or rule that we necessarily have to follow, but these are recommendations that this committee made, to all the professions in Texas. Okay. Let's see here. Dr. Elder?
Yes. Okay. So what is covered on this slide is how we, as the Texas State Board of Examiners of Marriage and Family Therapists, responded to the Uvalde report and all of the recommendations that were provided to us for increasing access to mental health care in the state of Texas and the citizens of Texas. So we've divided it into 4 different categories. The first is just removing barriers to actual licensure. How do we get more boots on the ground, more licensed mental health therapists, more LMFTs? And what can we do as a board to make sure that happens faster? So we streamlined the application process. A lot of that happened when we moved from HHSC over to BHEC was created. All of those processes were much more streamlined, and we have reduced, I mean, as you probably have heard from colleagues, the licensure application process has gone from a 9-month to a 1-year process down to, I mean, sometimes it's a week people get their license returned to them. And so we've definitely streamlined that process to make it easier and faster. We also changed the associate license from a license that's renewable and has to be renewed every 2 years up to a 5-year or 60-month period to just, once you get your associate license, you have that sucker for 5 years. You don't have to renew it. You don't have to get CEUs while you are an associate. You do, of course, have to be under supervision, but it doesn't have to be renewed anymore. So it's a little bit easier in that way. It's reducing some of the logistical paperwork parts of being licensed as a therapist. And then we suspended some of the requirements in the government declared emergency. What that means is that we had said, you know, only a certain amount of your 3,000 hours of clinical experience, direct client contact could be, we had limited the amount of that could be done by telehealth. Well, of course, when COVID hit, the pandemic hit, we basically lifted that and said, you can exceed that amount because we're in a governor declared emergency state. And so we were able to accept a lot more of those telehealth kinds of hours than we normally would have, which allowed more people to be processed into full licensure than what we would have been able to do previously with all of those telehealth hours. We clarified the definition of a relational hour. We found that what different supervisors and different clinicians felt was a relational hour varied widely. And so we wanted to standardize that and make it easier for people to understand what can I count as a relational hour. And so we added a definition of what that is. We reduced those relational hour requirements from half. You have to have 1,500 direct. It was 750 had to be relational. We reduced it to 500 because we realized that that was a big barrier for people to full licensure, was getting those relational hours. So we reduced it. So 1/3 of your direct client contact hours now have to be relational. So we were preserving the competence of our clinicians who need to be able to work with more than one person in the room, while also making access to care as prevalent as possible. Hours accrued in a doctoral program can now be counted toward licensure. We changed that so we can, again, make it easier for people to get licensed. And in process right now is we had limited the amount of telehealth hours for your direct client contact hours. We had said only certain, like I think it was 500 of that, 1/3 could be telehealth. Now we've increased that to a half. Part of that is we just want to make it easier for people to get licensed. We want to reduce that barrier. The other piece of it is we are looking at the reality of the world we live in now, and we want you to be proficient in both online and in-person modalities. So we increased that to up to 750 hours. And then when it comes to supervision, we're still in process. We're trying to just remove that limit. A supervisor can have as many supervisees as they can appropriately supervise. And that is in line with LPC as well, what they've done. And then we also have now unlimited hours of supervision via video. We did limit contact by phone. We want it to be a face-to-face modality, but it could be video modality. So that again is lifting a barrier. So you can have a supervisor in a completely different city. And then any master's level supervisor can provide that supervision course. If you wish to become a supervisor, you have to do that 40-hour supervision course. And that can be provided. It doesn't have to be an MFT who provides that supervision course. So that's helping to get the supervision and more supervisors. Then when we look at portability, the academic and experience requirements are considered met if you're licensed in another jurisdiction for 2 years. So if somebody's licensed out of state, 2 years in good standing, we're saying, yep, come on in, you can have a Texas license. Whereas before it had to be 5 years. And so that's increasing access to mental health care in Texas by allowing more people to come and get a Texas license with less requirements out of state before being able to do that. And then in process, we're looking to establish, it's in process right now, a temporary license for out-of-state licensees so that they can say, I want a temporary license in Texas, and it gives them the permission to to actually practice in Texas for 30 non-consecutive days per year. So they can come in, let's say they have a college student who comes back to Texas for summer, that allows them to practice with that client over the summer, and that client goes back. Or you have a client who's on vacation in Texas. So we want to make sure that we have access, as many people have access to care as possible. And then when we look at CEs, we did have it where if you're providing any kind of telehealth services, telesupervision, mental health services, you had to have 15 hours of CEs in telehealth, and we've reduced that to 2 hours. That was a big barrier that we've gotten rid of or reduced. And then we removed the pre-certification of CE providers. If you remember a long time ago, CE providers had to get approval to be on the list of approved providers, and then you had to make sure your CE provider was on that list so you could count those hours towards your CEs, and that's gone now. As long as your CE provider meets the requirements that are outlined in the rules, then you can get it from any provider. And then also through the standardization committee, which is a part of BHEC, we have tried our best to standardize the CEs that are required across LPC, social work, psychology, and MFT, so that if you're dually licensed, you're not having to struggle with all those different requirements. So these are just examples of what we've done to try to maintain competent clinicians while also increasing access to care. Thank you. Lisa, I'll turn that back over to you.
Yes, excellent. Thank you, Jody. Okay, next, we are going to talk about some challenges. And so, Janine, you are up.
Thank you, Chair Merchant. Hi, everybody. It's good to be here with you. A lot of times we'll get feedback from you guys, and you'll say, why can't you do this? Why can't you do this? We want to change. And they're great ideas, and we want to do them. This is the challenge of any state agency that we have in the state of Texas. The state of Texas requires, legislatively wise, that we have statute and we have rules. The rules, we have a lot more flexibility over, as long as they don't conflict with the statute. So when we are having to change big items, we have to go back to the Texas legislature and ask to change this. Now, you guys may or may not know, but Texas is a biennial state, which means that the Texas legislature only meets every other year. So we just got through with the last session. It ended in May of this year, 2023. So the next time that all the lawmakers are here will be obviously 2025. Now, legislature creates the statutes. Like I said, TSB, MFT creates the rules that align with statutes. That's the same thing for BHEC. The legislature helped to create it, and then BHEC has to have the rules that align with the statute. This is where we have our challenges, because we will be having a 4-year review in 2024, and we have to change statutes so that it can happen. However, we have to wait till 2025 to be able to do that. So we have a little bit of a conflict. We as an agency, TSB, MFT, cannot ask, lobby, go to the Texas legislature to ask for the changes. You as an individual can, or professional associations can. I also serve as the liaison to BHEC for your MFTs. And it was crushing this year to see all the different legislative things that were filed from psychology, MFT, LPC, and social work. And we have to sit back and just wring our hands hoping that stuff gets changed. These are the things that are on our radar that we already know. Portability. When Lisa and Jody were talking about people coming into Texas, how we're trying to remove barriers from that, because what COVID told all of us is that we get clients here in the state of Texas. We are working with them. They are benefiting from the work we're doing with them, but then they leave for 1 month, 3 months, 6 months for their other house. And that puts us in a bind, as well as puts our clients in a bind, because we can no longer treat them. They have now gone out of our state. And unless you are also licensed in the state they've gone to, you cannot continue to see them. This is a huge challenge. So that's called portability, taking your license across state lines, portability. So psychologists are working on compacts. LPCs are working on compacts. We are looking at what do we need to do to be able to change our statute to even have a compact. And so compacts are also not managed by, BHEC wouldn't manage it, TSB MFT would not manage it, an agency would not manage a compact. That would mean if I had a license in good standing and I wanted to go to Arizona, I need this third party to be the recipient to be able to talk to those states to say, yes, Janine's in good standing. Okay, she can practice in Arizona. So we figured until we have another chance in the legislature that we would, on our end, open up more portability. So we can show this doesn't overrun anything. This takes care of more rural areas that might not have ability to see an MFT, different things like that. So we are trying to make it to where we uphold our standards, but allow people to come in with ease so that then we can hopefully go out with ease. Currently, there is not a third party that will sponsor an MFT compact. So we are still looking around to see how can we do this? Who can do this? And we'll find them. Some group. I remain optimistic that some group will be able to do that. So any kind of, like on the wonderful slide, universal licensing, endorsement by license, or reciprocity, all of those things have to do with legislative action. So next slide, please. So these bills, this is when you see SB in front of the numbers, that means it was a Senate bill. It was proposed by the Senate. When you see HB in front of any numbers, that's a House bill. For bills to really work, they normally have matching bills. One occurs in the House, one occurs in the Senate. It gets passed in the House, it gets passed in the Senate, it reaches the entire floor, it votes on, it passes, then it goes to the governor's desk. The governor has an opportunity to either sign it into law, boot it out, or not do anything for a certain amount of days, and then it becomes law. So it might be something on his desk that he really doesn't want to endorse, but doesn't want to kill it either. So he allows the days to pass, and then it becomes law. These are just some of the bills that were addressing portability and licensure. And every single mental health bill that we had this last session died. It was either killed, somebody on the floor, usually your lieutenant governor can kill bills. That means that everything that was going to be heard that day is dead and there is no comeback. You have to wait for another session. So that was crushing for us to sit back and watch it. And all I can tell you is that change comes from bottom up. It has to come from you guys. It has to come from the association. It has to come from individuals. That's who makes change. Now, you may even think, how do I even do that? That seems so overwhelming. I don't even know how to track a bill. In the chat right now, we've just opened it for just a couple of seconds, just so that you can actually see the chat. I have put the address so you guys can copy and paste this address right here, capital.texas.gov.bill lookup.bill number. You'll start out with capital.texas.gov, and in there is a place that you can put your email address that you choose. You can also click which type of bills you want to be alerted to, so that when a bill, say that you are an MFT and you mostly deal with children, and excuse me, you mostly deal with kiddos. Well, you may not only just want to know mental health bills, you also may want to know anything that has to do with children. And so you would click that box, you click this box, you click this box. Then when bills that are filed, when those come across, you will be sent an email of the bill number. You can read the entire bill. You can kind of track how it's going. Where is it? Is it still in the sponsor's office? Has it made it out of the sponsor's office? Is it in calendars, which means they will allow it to be heard? So where in the process will that be? That's how you can track that. And then you can work with your association, you can work with other groups that are wanting to help pass that bill, if that makes sense. And I encourage all of you guys to do that, because that's how you get into those moments of, wow, I didn't know that happened. Those aren't fun. The other things that aren't on here that we also are wanting to address in the Uvalde report that Daniel talked about, there were a lot of recommendations that we don't have. It was like, get more out, get this, get this. And we know that one of the hugest hindrances to our license is, as soon as you graduate, where can I practice? Unlike, as your associate is basically the same time as your residency if you're a medical doctor. Well, it's easier as a medical doctor. You're going to go to a hospital. You're going to do your intern work there before you into private practice. We don't have that. So that is my big dream, is that how our students are taken care of after they get out of graduation. That's huge, because there isn't a place for them to do it. So the burden for paying for supervisors, paying for this, the burden is all on the people that are graduating. And that's what is a huge hindrance to getting more numbers of healthcare workers out there. And we know it. So we got a lot of people on the ground trying to come up with different ways of addressing that problem. So just want to let you know, we do have that. I do have that on my back burner. I know that that's a problem. Thank you for letting me rant about government stuff.
Okay, thank you, Janine. One thing I want to say really quickly, kind of going back to the, nope, that's not what I wanted. Hold on. Going back to the challenges for a second. When we do our 4-year rule review, already we suspect that there are going to be some rules that we might be out of sync. We need to do a more thorough examination to see. But the thing is if these rules are out of sync, then even if they are beneficial and wonderful and helpful and help people get licensed quickly in Texas, like, they're going to have to go away. And so the only way to have fixes for these rules that might be out of sync is with legislative action. So for example, one of the rules that might be out of sync is regarding the ability of graduate students, to count some of their hours that they acquire in their master's program towards licensure. There's other rules, that 2-year rule that allows us to do that we're using right now for endorsement, like that also is kind of questionable. We're gonna have to do an examination of that. And so, like, if those 2 rules were to go away, it would just, I think, very much hinder the ability of people to get licensed quickly in Texas. It would hinder the ability of people to come into Texas. What that would mean if that rule went away is that if somebody moved to Texas and they were licensed in another jurisdiction, they would have to meet Texas requirements in order to get licensed. They'd have to meet our education requirements, our experience requirements. So if they came from a state where they only had to get 1,000 hours of clinical experience, if that rule went away, then that means that they would have to go back under supervision and get an additional 500 hours of direct experience, even if they had been licensed for 20 years. And so we do not want to go backwards. And so anyway, so I just want to reiterate that I think it's so important what Janine was saying, that these are changes that are going to require licensees and professional associations. It's going to require action on y'all's part in order to make some of these changes. So, okay, with that, I am going to open the, let's see here. Whoop, there we go. Okay, so now we're to the part where we just want to hear from you guys. So what questions do you have? What ideas do you have? I'd like to hear about some of those. We'd like to hear about those things. Also, I do want to say that if you have a specific question about like your license application or an ethical complaint that's been filed against you, like we can't answer any of those questions here. So this is just kind of for general questions. So Ms. Fastholes, how do we want to handle this portion?
Sorry, I was
That's
fine. I think so. If you are attending by computer, please raise your hand. Do you want to limit, or do you want more of a discussion type of thing? I have 3 hands raised so far out of 50 attendees, 5 hands.
Yeah, well, I'd say let's call on one of the hands and we'll try to answer their question.
Okay. Sarah Francis. Oh, it just jumped. Sarah Francis, can you unmute?
Yeah, sorry. So one of my questions was I've heard about AAMFT's like Access MFT's kind of initiative. Mm-hmm. And so my question was just kind of around
yeah,
if that would be an example of like a third party management.
Well, WMFT did a couple of years ago, or maybe a year ago, they looked into portability to see if that would be a potential solution. And essentially, doing a compact is incredibly expensive, like millions and millions of dollars to start one, to fund one, to manage one. And so WMFT basically decided that that was not the path that they wanted to take. So the path that they've taken is what you're talking about, which is the MFT access. And so their goal right now is to work with a handful of states just to try to increase like portability, reciprocity, endorsement, basically to take a legislative approach and try to change the rules, you know, to help like organizations, you know, like, so if Access Texas were to help, or if Access MFT were to help Texas, they would probably come and work with TAMFT to help them lobby and create some changes, you know, legislatively. So that's the approach they're taking, is to go to target legislation and statutes as opposed to doing a compact.
Lisa, I also want to jump in on that as well. Another reason why, one of the questions was, can WMFT or can ACA do this? ACA can't do it because that's not our license. Our license is an MFT license. It's a nationwide license. So ACA doesn't really have any jurisdiction over that. They are doing for LPCs. WMFT, as Lisa said, has chosen not to go that route. And one of the other reasons is WMFT doesn't have state chapters. They have regional kind of chapters. They elected to let go of all state chapters, I want to say 7 years ago, 6 years ago. I can't remember. It's been a while now. And so they are not available to do that as well.
Jody?
So just for the edification of our audience, could Dr. Merchant or Mrs. Smith please clarify the distinction between a compact, a licensure compact, endorsement, reciprocity, portability? What do those words mean? How are they different? And what do we have control over, or the ability to influence, and what do we not?
Yeah. So with a compact, it would be basically a bunch of several states would enter into this compact where, like, you would have a Texas license, and then if you wanted to be a member of the compact, you would also get like a compact license. It would then enable you to practice in like whatever states are also participating in that compact. And that's kind of what LPC has. And I think psychologists have that too, or LPCs are in the process of, I think that was, again, legislation that they were hoping would pass this year that did not. So with reciprocity, that is where 2 states enter into an agreement. So like we would maybe go to Oklahoma or New Mexico and basically say, we consider your licensing requirements substantially similar. You consider ours substantially similar. So if somebody gets a license in Oklahoma, then through reciprocity, they can also get a license in Texas. But again, that requires legislative action. Neither BHEC nor the board can enter into reciprocity agreements with other states.
Based on our current statute.
Based on our current statute, yeah. Yes.
Not our rules, but our statutes.
Yeah.
And so I just want to make sure we're still making sure that distinction.
Yeah.
Because, yeah, what Lisa's saying, none of them, we can do none of this.
Yeah.
Not endorsement, not reciprocity, not compacts. We don't have the ability to do that at this time.
Endorsement is basically where we would kind of like we have now, which is where we say if somebody has been licensed in another jurisdiction for at least 2 years, then their academic and experience requirements are considered to have been met. So we do sort of somewhat have kind of an endorsement model presently. Some states have a much wider, where if you're just licensed in another state, regardless of how long, you can get a license in their state, or some it's maybe a year. That is what's actually the recommendation from AMFTRB is for 1 year. And then universal licensure, That is kind of similar. Again, that is usually done at the state level. Again, the board does not have the ability to create universal licensure. Universal licensure would basically, at the state level, the state would say, Arizona did this, I think, last year, where basically they would say, if you're licensed in another state in any occupation, with maybe some exceptions, like say maybe medical doctors, then if you come to Texas, your licensure, you can get a license here. And so universal licensure is generally a very broad, it's a very broad stroke. So hopefully that helps.
And Lisa, somebody had asked a question, how much of this applies to LPCs? I just wanted to address that. The ideas of what you can change versus statutes and rule, that applies to every license for mental health in Texas, whether you're an LPC, MFT, social worker, or psychologist. I will let you know that for your LPC license, that they are further ahead as far as developing compacts or crossing state lines than we currently are, because ACA has a different involvement than WMFT does.
Okay, what is our next question, Sarah?
Carrie Mead, are you able to unmute? Miss Mead? Carrie Mead? We'll come back.
Yeah.
Victor Love, you have a question? Victor Love, can you unmute?
Am I unmuted now?
Excellent, we can hear you.
Hey,
Yes.
Victor.
Hey, everybody. Lisa, Janine, good to see you guys. Janine already responded and explained that ACA isn't part of our licensure, so they can't help. AAMFT has chosen not to so far. So my question got answered. Thank you.
Awesome. Okay, what other questions?
Hello.
Carol Greenberg.
Oh, I think Carrie Mead is ready.
Okay.
I'm sorry. I had my AirPods on and for some reason it wasn't letting me unmute or speak. So I apologize. Thank you for this opportunity. Coming from another state and wanting to relocate to Texas, my question is pretty specific, but maybe others could benefit if they're coming from out of state. What I read on your website for licensure, I just want to clarify. So my requirements from Indiana of education, supervision, my hours, I will get all of that finished up in June of coming this next year. Then I want to move to Texas in September. So do I understand that my LMFTA licensure here in Indiana would qualify me to then come into Texas with the requirements you have online to then become licensed in Texas if I meet those requirements in that online test?
Okay, so I'm going to answer your question as best I can. Sarah, you correct me if I give any misinformation, but the 2-year rule only applies to people who've been fully licensed, so not under supervision. So if you were to, you said you're going to get licensed in June and then move here next September. Is that correct?
It'll just be a couple of months there that I will have had my full license, but yes. I am under supervision, full supervision within a clinic now in Indiana.
Mm-hmm. So in that case, staff would look at, you would have to basically meet our licensure requirements. So the 3,000 hours, 1,500 direct hours, at least 500 hours of to couples and families, 200 hours of supervision. Like you would have to meet all of our requirements if you were to move that soon after after becoming fully licensed.
Okay, perfect. And can I just simply ask, how are those 3,000 hours qualified? Like I'm in Indiana, we're only required 1,000 direct clinical hours. What do I need to be doing to document my full hours?
Yeah, so the other indirect hours are things like going to trainings, writing case notes, attending staff meetings.
Okay,
yeah, so just all like the things that you do associated with practice that aren't actually you in a room with a client.
Yep. Okay. No problem. That's very helpful. Thank you.
You're welcome. Okay. Was there another question?
Carol Greenberg. Can you?
Yes.
Excellent. Yes.
Hi, Carol.
Okay. I am an LPC, but I have a question and you may not be able to answer it. What's the difference in home study for counting towards your renewal or CEs? Is there a difference and do they count the same?
Are you talking about the self-study, like one of the CEUs, you can count 1 hour of self-study?
Right. I have an option to, well, I don't know how many hours. I have an option to do something over several hours because I wouldn't have to take off a whole day as a home study. And then does that count?
Do you get a CE certificate?
I'm sorry?
Will you be getting a CE certificate?
I will, but they're calling it home study.
That's fine. As long as you get a CE certificate, it's going to count as like your, towards your regular normal hours.
Okay.
The self-study is basically for activities you aren't going to get a CE certificate for. So like reading a book, reading a journal article.
Okay, right.
Yeah,
which counts if you're under supervision, but not right for licensure. Yeah, I get that. That's what I was trying to find out. I said, do y'all count the home study as CEs for, and they said, you need to check with your board. So I said, okay, whatever.
Yeah. If you're getting a CE certificate, it should just count as your regular hours. If you're doing an activity that doesn't produce a CE certificate, then that would be that self-study.
Got it. Thank you. Appreciate it.
You're welcome.
Before we call on somebody else, I just wanted to kind of piggyback on that as well. And what we were talking about with our statutes and rules. If you guys will really familiarize yourself with the BHEC website. I tried to cut and paste it, but I think the chat's off, but it's just BHEC, BHEC.texas.gov. Then you can put /statutes and you can see that your occupation codes are our statutes. And they are administered by Occupation Code Chapter 501, 502, 503, 505, and 507. And all of our statutes are in there. In addition, the staff at BHEC and the individual licensees, people that work for them, have done a fantastic job of making the website so user-friendly. And some of the that you might have and some of the questions that you might have in the future, you can find in your consolidated rule books. All 4 licenses have a consolidated rule book now, as well as any relevant statutes that are going on, any relevant administration rules. And then when you click to your own individual license up there at the top right on BHEC, you'll be able to see what are the proposed rules, not just our proposed rules for BHEC, but what are the proposed rules for marriage and family therapists and what has passed, if anything's updated. And that's a great way to answer some of your questions.
Ms. Francis, do you have another question?
Yeah, I put it in the Q&A, but I noticed that it said that it's in process for increasing the telehealth limits to 750 hours for associates. I was just wondering if there was like an estimate on when that's going to go into effect officially.
Oh, I have no idea. So where it is in the rulemaking process, if I remember correctly, Sarah, correct me if I'm wrong, is it was just closed for public comment. So it was open for public comment until I think maybe just a couple of days ago, I believe. So then the next step is at the January board meeting, we will review all the public comment and see what the public thinks, if they're, if licensees are supportive or not supportive. At that meeting, we'll make a decision about whether to adopt the rule as it is or to maybe make changes to the rule, depending on just the feedback that we got. After that, it'll go to BHEC. And I'm not sure when BHEC meets in the spring, but they will meet sometime in the spring. I think they usually meet around April, but anyways, they'll meet in the spring, and then basically they will either approve the rule or they will send it back to us for revision. If they approve the rule, then it goes back to the Texas Registrar for publication. So I would say the earliest would be maybe in the summer or fall, perhaps, just depending on how this rulemaking process goes. Jody.
Okay, so I just want to add on to what Dr. Merchant just said. When she talks about public comment, that's you, that's licensees, that's just members of the Texas public. You have the ability to write in and tell us what you think about rules that are in process. And we read every single one of them. We take your recommendations and your feedback into consideration as we decide whether or not to pass it on or amend it and then pass it on or just nix it completely. We would love to hear from you. So keep in mind that that is something that you have access to, and they've made it so easy through the BHEC website how to provide that feedback for us. So please consider doing that. We would very much appreciate it.
The two things.
I was going to say the next time that we will be meeting for BHEC is in February.
Okay, thank you. Thank you. Okay. Two comments off that. Number one, if any of y'all don't get the BHEC the BHEC email updates, I would encourage you to sign up. And then anytime that something goes up for public comment, you will get an email and it'll tell you that things are open for public comment. The other thing is, we really do listen to you guys. It was last year, I was at a TAMFT meeting doing a presentation, and a supervisor came up to me and she said, I really think y'all need to get rid of that limit that you can only supervise 12 supervisees at one time. She's like, she's like, I love supervision. I'm good at it and I want to do more of it. And it stinks that I'm limited to 12. And so I was like, wow, what a great idea. So I took it back to the board. We had a conversation and here we are. And so we really do want to, hear what you guys have to say. Okay. Any other questions?
So Ms. Greenberg, were you finished?
Yes. I mean, I was just curious about if home study counted as a CE.
Okay.
Okay.
Are there any other questions?
There are, just a moment.
Okay.
Christy Phillips. Can you unmute?
Yes. Can y'all hear me?
Yes.
Great. Ms. Smith, you mentioned earlier the challenges with associates gaining their hours after graduation. And I agree, it's a huge challenge to meet the demand. And so I'm curious, do y'all see addressing that issue as a board issue? Is it a legislative advocacy issue? Is it both? What is sort of the overall vision, or even like, is there a strategic plan to address that?
Thank you, Christy. Sorry. Go ahead. I was just gonna, it is a multi-pronged thing, because you'd have to get funding for those kind of groups to be able to spring up, which I'd like to see. I think it is also, so I think it's a three-prong, and Lisa and Jody, you guys chime in. I think it's a legislative fix. I think it's an education fix. And I think it is just a groundswell, getting more and more people, because we have to have funding to open up. It'd be like, hi, I want to open up a new hospital on a very small scale. But hi, I'd like to open up something where people can go and work and get trained and clients come in and see it. More public access to that. And so that's where I feel like that. So, but to answer your question, Christy, there's not currently a strategic plan on the table, because we've just now kind of been like, this is my response. I'll probably get in trouble. Sarah's already quaking now. I'm sure if Tim was here, he'd be quaking. But we just got the Uvalde report, I want to say 10 months ago, I can't remember. And a lot of the recommendations that came from the legislative body were things that are out of our control. Yeah, we would love to make the access a whole lot easier. So it was really frustrating to get that report and realize a lot of the things that they were saying that need to happen, our hands are tied. We have to have more places for practitioners to practice. Not every single person has the ability to get out of school and open up a private practice and support their families and live and pay their rents. So there are certain barriers that we have to address of how does the schooling, how does the training go for mental health workers so that it could match the same thing that happens to nurses, doctors. There's a place for them to practice.
I'll add, Christy, that the 3,000 hour requirement, the 1,500 direct, 1,500 indirect, 200 hours of supervision, all of that is in our statute. And so therefore the board cannot change it. Honestly, most states don't do direct and indirect. It makes it difficult for people, as I don't remember who it was, but whoever's coming from Indiana, like, you know, now she's got to figure out how to account for all these indirect hours. So things like that get in the way of just of that portability. And so yes, so the 3,000 hours, 1,500 direct, indirect, 200 hours of supervision, like that's not something that we can address without a legislative fix first.
Yeah, and I would think too that there's plenty of work. There's plenty of opportunity to get the hours. It's how do we pay them? I'm executive director at a nonprofit organization, and so you know our challenge is paying both fully licensed and associate level people, you know, what they deserve to be paid.
Yeah.
And we really try to come up with ways to give associates full-time work so that we create a funnel into being fully licensed and hopefully continuing to stay and work for us. But we can only do so much of that when, you know, they're not able to do things like bill Medicaid and those kinds of things. And so there's huge demand. To me, it's not about necessarily getting the direct service hours. It's about how can we pay people a living wage, especially when so many people go into this career as a second career. They're later on in life, they've got kids who are, you know, and things like that they're trying to support their families. And so to me, I know that parity is an issue with payment and all of those kinds of things. And being able to pay people for their expertise and the important work that they're doing.
Yeah. Well, I think I saw in the chat, somebody asked about Medicaid. I would love it if MFT associates and all associates, LPC associates, I would love it if they could take Medicaid. That is a state issue. Again, it requires a okay, you say no? Because
Medicaid is a national issue.
It is, but I think that because there was a bill in the legislature this year that would have allowed Texas Medicaid to pay associates. And I do know that in other states, associates can bill Medicaid. So there's something about Texas and Texas requirements that we cannot. So again, requires legislation that we can't do anything about.
There are a couple of questions in the Q&A. Lavelda Naylor stated, in my experience, if more LMFT associates could get on insurance panels, their hours could accrue much quicker. Yep. Who would be able to address the problem of insurance paneling for associates? And also, Victor Love wrote, while changes in education practice and supervision can drive more opportunity after graduation, third-party payer rules, that is, no insurance plan pays for a marital or family problem without an individual being diagnosed, in my opinion, Mr. Love's opinion, that is, creates the choke point for opportunities to practice and get paid. Would the board members like to address that?
Yes. Legislation, legislation, legislation. We don't have any control over that except changing that through, I mean, we can't, you can lobby for it, but it would be, that would be a legislation fix, because you're 100% right. Insurance is a giant gatekeeper.
And then Faith Ray has had her hand up for some time. And she's also had a couple of questions in the Q&A. Ms. Ray, can you unmute?
Yes, can you hear me?
Yes.
Okay, good. I was afraid I wouldn't be able to be heard today. I'm a dual approved supervisor, and my question's in a little bit of a different vein. I would like to advocate for MFT loosening its rules about supervision by phone. And I would like to make the point that I understand that the logic has been it's helpful to assess the supervisees, you know, body language, et cetera, through having them in some kind of a format that's more like Zoom. But I have a couple of people that have terrible internet service at where they're at. And we try to do Zoom meetings, 2 to 3 times a month and meet face to face some. And we end up having to hang up and do it by phone because of their internet service. LPC is so much easier to work with. They let the supervisor be responsible for determining if they know their supervisee well enough, if they're, if they can read their body language and hear, what concerns they have. And I would respectfully like MFT to be in parity with LPC in that regard, so I could do more phone supervision with those people that have terrible internet. So I'm just putting that out there as something for y'all to consider.
Mm-hmm.
We're rural, and I know that in your heart y'all understand the challenges of us rural therapists with terrible internet.
Yes. Yeah. Thank you, Ms. Ray. It's a good point.
I just want to say thank you to Ms. Ray, because that's part of why we wanted to have this town hall, is what barriers are you experiencing? And we need to hear that. So I really appreciate the sentiment with which that was provided. And like, I'm trying to do supervision, I'm trying to provide services, I'm trying to get people licensed, and here's the obstacle that's getting in my way. Would love to hear from more of you about your experiences similar to that. Thank you.
Well, and I didn't know that LPC had a different rule, so that's also interesting. So anyways. Okay, we might have time for maybe one more question if anybody wants to throw one out there. Okay, well, hearing no other questions, no other hands are raised, right?
I see no other hands raised.
Okay. Thank you all for being here today. It has been a pleasure. We want to try to be an accessible board, so feel free to also use the Contact Me button on our webpage to reach out if you ever have questions or comments or suggestions. Also, there is a survey that recently went out, a customer satisfaction survey. And so again, I would encourage you all to also complete that survey and give us feedback so that, again, we can keep doing the things that seem to be working and we can fix the things that aren't. So, oh, yes, Jody.
So really quickly, for those of you who have obstacles you're experiencing, it is possible for you as a licensee to petition the board for a rule change. The process is outlined in the rules. Just go find it. You have to say like which rule you want changed, what you wanted to say. There's a specific format you follow, but you can submit that to us at any point in time through the Contact Me part of our website. So you don't have to wait for a board meeting. You don't have to wait for a proposed rule to go out for public comment. You can submit that to us at any time, and we welcome that kind of feedback. So know that that's an option as well.
Such a good point, Jody. And I just wanted to make a point. That's for associates and fully licensed. You don't need to be fully licensed before you start clanging your drums, man. Start speaking up now.
I've put the very long link to the customer service survey in the chat.
Thank you very much. Okay, y'all have a great rest of your Friday, and hopefully we'll see you at the next one of these.
Bye, everybody.
Thank you.
Thank you, Lisa.
Bye, thank you.
Bye.